Good morning, and welcome to the first virtual THA Annual Conference. Exactly a year ago, we were together in San Antonio at our annual conference when the word came down that the first case of COVID-19 had been confirmed in Texas. We were together, unified as an industry, on the cusp of a year we will never forget. As I begin this morning, I want to thank you from the bottom of my heart for your heroism on the front lines. A year ago, COVID-19 was an issue overseas that we hoped would stay boxed in and contained. We expected limited impact on health and human life in the United States. Over the last 12 months, it has now become the hospital industry's central focus right here at home. We faced shortages of staff, testing supplies, and PPE. We fought desperately for needed federal funding and resources, and our healthcare workers endured extreme burnout and exhaustion. We saw the first case, the first death, and the shutdowns. We grappled with therapeutics and other glimmers of hope. And finally, we watched science make history with the first COVID-19 vaccine. You all moved fast and charged ahead, dealing with ever-changing information about this disease. I know we all have our stories to tell. We will never forget this time living through our first pandemic together. You emerged as heroes, greater than ever before. The world watched as you made do with limited resources at the bedside of patients who were alone. Nurses, physicians, janitorial staff, laboratory technicians, specialists, food service workers, and countless others dutifully soldiered on. Your sacrifices and heroism will not be forgotten. You have changed the perception of what it takes, what it is to be a healthcare worker. During this pandemic, hospitals banded together, springing into action as cases surged and waned, adapting in real time as guidance changed about how to deal with this deadly disease. We flexed bed capacity and diligently established plans for vaccine administration. Hospitals and their employees were asked to manage all of this, and you handled it exceptionally well. And in all this commotion, we must remember, some sacrificed everything. I now want to take a moment of silence to remember the healthcare workers that we lost over the last year to this horrible disease. May they forever be in our hearts. Please join me in a moment of silence. Thank you. I want you to know that THA made it our mission to support and honor your work over the past year. Together, we pushed for the resources you needed to protect yourselves and your families. We defended your ability to handle surges and went to bat for hospitals on non-essential procedures. We assured the public that hospitals were vaccinating as fast as humanly possible. The most unprecedented vaccine rollout in history. THA speaks for all hospitals in Texas. We offer a statewide perspective about the miraculous work that you do. From our health to our pocketbooks, the pandemic has harmed many. We also know there have been some silver linings. Hospital credibility and clout soared in the spotlight, whether we wanted the attention or not. You were lifesavers. Even as the pandemic continues, we now are in the midst of the 2021 legislative session. We are seeing headway in many of the areas we care about most. Funding for healthcare programs and services, a fair and equitable system of financing hospital payments, and a renewed focus on funding for behavioral healthcare that more closely matches the need. At the federal level, over the last year, we were instrumental in dismantling MFAR, delaying imminent disproportionate share hospital payment cuts, both of which would have been economically devastating to the hospital industry. and most recently, the extension of the Medicaid 1115 waiver. Despite the distraction of the pandemic, there is clear momentum in our favor, and the time is now to address these challenges. Perhaps the most important and timely challenge? Access to necessary medical care. Texas leads the nation in the number of people without health insurance, and this has been exacerbated by COVID-19 job losses. Having health insurance improves access to care. If ever there was a time for Texas to increase access to health care coverage, it is now. Beyond the obvious health benefits, there also are major economic benefits for doing so, including lower insurance premiums in the private market, the potential for property tax benefits, fewer unreimbursed costs for hospitals, and assistance to balance state and local budgets. With coverage expansion, more Texans will get the care that they need when they need it. And we will have a healthier, more productive workforce to help strengthen the state's economy. As we move forward with our renewed light and hope, our work to protect healthcare workers and the general public must remain strong. We must continue to protect those who protect us and remind the public that they too are on the front lines of public health. Good hand hygiene and following all the tried and true prevention practices are the key to getting us to a sense of real normalcy. I believe this is possible for Texas. I know we all look forward to that. As healers and employers, putting others first is a hallmark of Texas hospitals. Hospitals bring new life into the world. You provide life-saving care day and night. You contribute to a strong economy, and hospitals always step up to perform public health miracles. From my heart, thank you, and welcome to the THA 2021 Annual Conference.